report shows that support for hospitals and emergency room patients is deteriorating. Joining us live with the results from this new report is the president of the American College of Emergency Physicians, Dr. John Mark Hirshon. Good morning, doctor.
Good morning, and thank you for this opportunity, Kennedy. Though I would like to correct one thing, which is that I'm the report card task force chair. So I was the one who was technically and conceptually the lead for the report card.
Well, we report that. Thank you for that correction. So, doctor, tell us what was the overall report card for the nation?
Well, overall, the nation dropped from a C- to a D+ for their support for emergency care. And the reason that this is important is because when a patient needs emergency medicine, emergency care, they need it. So if the support's not there for the system and for the structure, they're not going to be able to access that care when they need it.
And how did the state of Hawaii compare, and how did they do, and what kind of grade did they get?
Hawaii dropped from 16th overall in 2009 to 24th with a grade of C-. And of particular concern, they got an F in access to emergency care and an F in disaster preparedness. So if you look at access to emergency care, this is the ability to get the care you need. Do they have primary care providers? Do they have neurosurgeons and other specialists that are going to be there when you need emergency care? And unfortunately, Hawaii didn't do so well.
And that sounds somewhat alarming, somewhat of a concern. So what can state officials do? What can the state do to improve the emergency care systems that you're talking about?
Well, I think they need to do a number of things to support the environment and recognize that, you know, for people, when they need the care, they want it, they need to get their politicians to acknowledge and to support emergency care within the system. So they need to make sure that there's adequate inpatient beds, that there's enough hospitals, there's enough support for the physicians to provide the care, but also support trauma systems and the ability to take care of patients when injuries or illness occur. So I would recommend that folks go to www.emreportcard.org and they can take a look at Hawaii's specific grades as well as how Hawaii did last time and how other states did. There's 136 different measures in there that you'll be able to take a look at, and each of those measures can be used as a roadmap for ways to improve.
Well, some good information this morning. Dr. John Mark Hirshon from the American College of Emergency Physicians. Doctor, thank you very much.